Hosts and alters will have greater positive feelings of acceptance of themselves and others within. All identities in the system are valid and real and need to be treated as such. If you were treating someone with dissociative identity disorder and another alter came out, you would treat them just like you would treat any other person that walked into your office. If they're a separate person, you should introduce yourself to them, get to know them. Do not treat them as if they are not real. They are very much real. Greater range of positive emotions and behaviors, and hosts and alters will gain increased skills in communicating with others in the group and be able to have a greater understanding of themselves and their system by having such experiences. My friend and my other friend met for the first time, and we had dinner at my house, and both of them had another personality that came out, and then they hung out. And it was very interesting to see the interaction between the two, because they really did understand each other in a way no one else could. The one alter was talking about another one and was like, I think she's so annoying. I understand that if I hurt this body, I hurt myself, and I would never do that. But she's so annoying, she makes me want to kill myself. And the other person's alter said, oh my God, don't say that. That's what they say about me. So that's what she hears when she's back there. So very interesting. That's not an experience that we can relate to unless we were an alternate personality. Seriously. Reclip, please. Clinician recommendations. What I come up with is dissociative identity disorder patients may benefit from longer-term, homogeneous, more process-oriented groups for DID and complex PTSD patients. They should not be in any kind of support groups for sexual abuse. It's too triggering to bring up those memories and trauma. The nature of the disorder is to keep it a secret, so if you try to do that and they're not ready, you're going to get all kinds of people coming out to protect that system. However, a group where you treat the post-traumatic stress disorder and the anxiety can be very helpful. Will you click, please? If I was to run a group, we would have 2 leaders. One would be available in case someone is disruptive of the group. An alter might come out that's not happy and needs individual attention. I'll use my skills in the master's program to facilitate a group, and I also plan on seeking out educational and employment opportunities to develop and refine skills that would be specific to working with those with the ID. That is my plan. Be click, please. Member selection, we would be age 18 and up. I would request a written and verified referral from a mental health professional. A lot of people are fascinated by multiple personalities. I don't want fakers showing up to my group.
Oh, that's a good point.
We would post flyers at community mental health and contact incest, domestic violence, and sexual abuse support groups to recruit members. I say domestic violence because people who have VID have a tendency, because they've been abused so much, to get into abusive relationships. You click, please. Group size, I realize 8 to 10 members is a typical group size. This is not a typical group. I don't think that would be a good idea. Since we have, each member will have several identities, I wouldn't want any more than 5 people. It would be easier to communicate with less bodies. We got more people, but less bodies. Easier for authors to get to know one another, and less anxiety for those participating. We would meet once a week, hour and a half each. We would see about using a meeting room at CMH or a nonprofit organization that focuses on counseling, and we will meet for 8 weeks. We will have group discussions about and work on techniques to stay present when you do not want to leave. So many times I have seen my friends trying to fight to stay present in their own body, and someone else is fighting to come out. Sometimes they win, sometimes they lose. Sometimes they have teamwork. I have, like, the girl I've been dating, sometimes we do certain activities that someone else would prefer to go along with than her, so she lets someone else go. That's kind of a compromise. You keep everybody happy, they're less rebellious. That's my opinion. I'm not sure if that's true. That's what I want. That's what I've witnessed. Dating and relationship issues. We will have group discussions on coping with stress, anxiety, and panic attacks. Healthy choices versus non-healthy choices. Communication issues among alters and the host. Those are common. Coping strategies for meeting the needs of many. issues of safety and also coping with aggressive or self-harming alters. Group rules would be only one person speaks at a time, respect others' opinions, be gentle but be honest. Everything that is said here stays here. Use age-appropriate language and topics when child alters are present. They like to come out. Sometimes just see what's going on. If they come out during this group, I would hope that everyone would respect that. No outside communication between members while group is active, and no talk of specific trauma details, because you will trigger others, and it will become a bad thing for them. Enforcing group rules. We will sign contracts stating that we will follow the group rules and keep what happens in the group confidential. That's extremely important. If the nature of the disorder is to keep secrets, if someone shows up for a support group for this, people have got to respect that. Members that breach confidentiality will be removed. And when new alters present themselves during group, we will have to stop and take a few minutes to go over the rules and have them sign a contract. Have to remember that everyone is a separate person. During the first session, we will discuss which each member would like to gain from the group experience, and everyone will write down their personal goals. We will start the group each week by allowing each person to talk about how their week has been and any significant issues. We will use mindfulness techniques to work on reducing anxiety and staying in the present moment. And we will do group activities such as creating a special notebook that members can take home and use as a way for identities to communicate with one another. We will use role-playing, art, and small group discussion to get everyone involved. We will allow the group to help determine what kind of activities they would like to do. We will connect and learn from one another through dialogue and being open to others' experiences. If the group is comfortable, we may have a special day for children alters and allow them to play, color, and make friends. Someone else from the support group I belong to, when I asked for pictures, put this one on the board instead of use, and that's what she said. She said, "These butterflies are beautiful even though they are many contained in one shape, just as our headmates are special even though we only have one body." So she's really come to accept what's going on and values them. Ethical concerns. All members will have informed consent of how the group will function. Risks of being a part of the group will be discussed and assessed. If a client's behavior is harming to others in the group, it will be addressed appropriately and in a timely manner. Group leaders will always work with clients in ways that will benefit the client, and we will take all measures to ensure that we are following the ethical guidelines created by the American Counseling Association at all times. Group leaders will not have personal relationships with members of the group.
I'm sorry. How do I go back? Here?
I don't know. It'll go back one. I don't know how you go back.
I don't want to go.
Okay, well, it's that evaluation, and we will use evaluation by asking for feedback at the end of each group, checking in to see how people are feeling and how they're doing, and then when the group ends, 3 weeks afterwards, we will call them and do a survey, see how it went, if they met their personal goals, and ask them to come back to another one. So really, at the very first group, we'll set personal goals, and when it's done, and a couple weeks after it's done, and they have time to process, then we will talk about how it's going with the personal goals if they met them. Next Tuesday, the 2 people in my life that have multiple personalities are going to come to class to answer questions. We've created a little video of one of their alters, so you can see what it's like in real time or real life. And if you would reflect on what you've learned today, so you have questions for next week, I would appreciate it. Also, it's extremely, the support group I belong to, when I told them that we were doing this and that they were coming to class, they were like, "What? Really? Really? Because you don't do that. Keep it a secret. You keep, so the fact that they are willing to come here shows that they trust me and that they trust you guys. So please be respectful of that next week, and thank you for giving me the opportunity to use the forum to teach about it. And
That was excellent.
thank you.
Can we ask you questions, or we can say the question next week?
Oh, you can ask me questions. Go ahead.
Okay. I have a list.